So thank you everyone for staying through the last session. Fantastic talks. So since we did not have a common theme across, here are my a couple questions, right? So it's been exciting and interesting conversations on various topics in the last 2 days. What are your top 1 to 3 takeaways? You can name just one or up to three from the last 2 days of discussion. What's your any aha moments or surprise, something, some new insights? What are the key takeaways?
Looks like a trick exam question, so I'll let you take it.
Because I'm in the back to that exam question mode.
A student, anyway.
Yeah. So for me, I think looking forward to Indo-US collaboration is something, and I think it's the high time, right time, and the kind of collaborations going on. And I see people who are working in both the space, both in India and US. I think that is wonderful. And I have already, me and Harsha, we have connected many patients, right, who were either in US looking for similar genotypes in India. We had such cases who had started therapies in India, in US. Remember the child who started enzyme replacement therapy in India at the age of 3 months, only to find out at a later stage that the enzyme replacement therapy was not required because it was a silent mutation for Indian population. So the child was taken off ERT at I think 12 months of age, right? So that was and that was through where I connected them to Harsha, and through Indo-US Rare, they got connected to more patients in India and found out that in Indian patient that was not a common mutation. So, and that was an Indian origin child in US. And then there were other cases in India who were completely unknown to what kind of treatment they could access, and when through getting connected to Indo-US Rare, they got connected to doctors and clinicians here and found out therapies they could access sitting back there in India. So I think looking forward, there could be many other collaborations taking from drug development to many other things, which starts from this kind of conferences. So really looking forward.
Dean?
Yeah, I think for me, it's kind of a sigh of relief, actually, and then this a scared feeling as well. The sigh of relief is that so many times when we take on a new project, it's the uncertainty that gets at you. And I think I know something about India and the population and the culture, and really what I know is the food, and it's awesome. I think just listening to all of you, I've just found a lot of common ground and that encouragement to take those next few steps. We know we have patients over in that part of the world. We're contacted by them almost weekly. Already developed a relationship to help us refer patients over there, but particularly being able to work on some of the policy and the access, because we're pretty close to the finish line in the US on a therapy approval. So taking those next steps over there on behalf of 5 times the population, clearly that's going to be a big challenge because reimbursement's a challenge. The country is very large, a lot of people. We think the US is big, and it's just bigger than some. So I think that's my biggest takeaway at this point, is really more of, yeah, that's what I thought. Let's get at it.
And I think for me, it's the potential and the sort of potentially inflection point that we're at with, so much technology and genomics, but also in being able to communicate with each other across globally very easily. So the potential to do some co-learning for us to maybe support patients in India, but also to be learning from the huge population there and all of the skill and expertise there. So some real opportunities.
Can you hear me?
So I think 2 points. One was I was really amazed by how many influential people you have here and calling in from India. And it's this like getting everybody in a room to actually talk about meaningful change is important. We've done a lot of that, but I think if we can use that momentum to actually come up with that white paper or the book that the previous speaker was speaking about, that would be like the blueprint for what happens next would be great, because the challenge is always getting this group of people in a room to talk about like actual actionable change. The second was I was super excited to learn about the centers of excellence. if you see my LinkedIn post, I'm constantly harping about the lack of genomic diversity in the US population data sets. I think India is going to basically outcompete the US very shortly by giving access to population genomic data, and that's going to be helpful really for patients worldwide. So I'm very excited about that.
Yeah, personally for me, Harsha, it's been a great learning experience. I had not realized the number of advocacy groups. I bet it's only a small number, but still, it's quite moving. And I knew moms were very fierce and sensitive about their kids and protecting them. I knew Harsha was an exception among guys, but it looks like we got Dean and many more men who are equally protective of their kids, and that's wonderful.
But we did learn today, it's all the women. Thank you very much. I'd just like to reinforce what you said about the gathering and the convening, because I've talked to a lot of people as I've done these interviews, and that was the singular common theme was what you and your team have done to bring together people to start or continue to reinforce the networking and collaborations. And I'm not experienced enough in this to know that maybe that hasn't been done before. But if you had to ask me, I'd say nobody's done it, or certainly not to the level that you all did it. And that's really, really important to get us all going.
Dr. Gulati?
I think, I think it was something that all sides are very much eager to collaborate and work together for the cause of these children and families. That is what I felt. And I mean, this is really very nice. And I think it's very nice that you've taken this initiative at a big step. But even if you get the blueprint, but my only request would be we should make some short-term and long-term goals, because in the past we had made some guideline, a book was removed, we had made something for the special needs children, how to advocate it in the country. And we had made that, that it should be having they should be breaking the maze for the people at the district level, because there were 4 ministries involved with the disability sector: Ministry of Health and Ministry of Social Justice and HRD and Women and Child Development. So they will work in silos, but the parents don't want to know which ministry they are. They should have things streamlined by somebody at the district level. So that thing was a very good blueprint taken out, but it just remained a blueprint. So I'm just saying that you take out a blueprint, but just ensure that, some kind of short-term goals are there, and some things, you may have, you are going to be having annual meetings, I guess, from what I saw from the mail. So I think something will have to be continue to go, so that the energy which has come up and people are interested in working. So I think, they should be working and ensure that there's a push somewhere so that they actually do work, and that is how I look forward to it. Thank you so much.
Absolutely. Dr. Gulati, next year we are coming to New Delhi. And so really excited that we'll be able to bring a delegation of all the stakeholders from United States, and we'll have a fantastic continuation of this conversation there. But really appreciate that short-term, long-term blueprint plan, which will certainly be engaging all of you in developing that. So one final question, what's your crystal ball? If you had a crystal ball for next 40 years of Orphan Drug Act, we had 1,100 approved orphan drugs, and most of us have difficulty thinking 40 minutes ahead. I don't know when I'll get back home yet. So, but if we were to make a wish for what's ahead and what we can achieve, the potential, as we have seen, especially a lot of the genomic talks and the human genome-based hype or say expectation or hope that was created in 2000 when the first human genome was completed, that we are going to have a cure for most monogenic diseases very soon. It's been 23 years now, maybe 21 after the first annotated genome. And we know where we are, 11 approved gene therapies. But it always takes at least twice longer and cost twice as much. Maybe in this case, it's taken 10 times longer and 10 times more. But what's your crystal ball in terms of next, however long you can think about of the Orphan Drug Act?
Again, me, it seems. So 2 things. One is, of course, with technology improving, we'll have more and more discoveries and invention happening in terms of more drugs coming up and more SNPs and being identified. but also the de-luxury branding of the drugs. I think that should be the most important. Reasonable pricing, increasing accessibility, and looking into the LMIC as not as a compassionate market. They are market and not a compassionate ground. How to taper those market, not as a compassionate. To me, it seems like compassionate programs are not sustainable. These are short-term programs. There has to be strategies, long-term, how to make this market accessible to the drugs and drugs to access the market. There should be strategies in that.
So the day I turned 40, I started wearing glasses. So my crystal ball might be there, but I can't see it. I think that first off, I'm excited. Last night we had teenagers, high schoolers, kind of leading us through the evening. I'm excited by the next generations. There's a lot of gray hair and missing hair in this room, but we know that the people that are doing a lot of this work, for better or worse, there's a lot of data informatics and that sort of stuff, and that's a lot of younger folks. We're struggling to get younger investigators, new investigators. But I think that, genetic counseling is a field that is as powerful and yet as young as the Orphan Drug Act was 30 years ago. So there's a lot of things that are happening. I am confident that the passion of us and how we demonstrate that back through our teams and our peers is really what's going to change the world. And if it's science, if it's reimbursement, if it's connecting families, finding families, whatever that is, I think it's the passion that the Orphan Drug Act ignited that will get us through those challenges. I'm an engineer by training. Frankly, I know the science is really complicated, but I'm not worried about that. I think there's a lot of policy things and those sorts of things, and just people willing to let down barriers, to share. Personally, publish or perish. I love publishing, but I got to tell you, we got to publish. We got to publish the bad. We got to publish the good. We have to do that more quickly, more efficiently, more openly, share data. So we're learning how to do those things. So there's a lot of pieces that are really coming into focus that I think are going to get us through there. When we're really old and gray and we look back on what our kids or our grandkids or their generations have done, I hope that we're really proud, and I think we will be.
So my two things are, the first is that babies get a diagnosis right from the start. I think, there's so much loss and economic loss and pain and suffering to get to a diagnosis in this country, in India. We don't know much about Prader-Willi syndrome in India because, those children and adults are probably not getting diagnosed. So I would hope in 40 years that everybody gets a diagnosis early. And then I think the other thing is, if you look 40 years ago, the patient input to the drug development process was not even really considered. So we've seen over the last 10 years or so, the FDA trying to incorporate the patient experience, trying to make sure that treatments are clinically meaningful. I think there's a lot more that can be done. And what I hope is that 40 years from now, that, babies are diagnosed right at the get-go, and then there are treatments. I'll let everybody else work on the treatments, get those in place, but that there's access to treatments that are really meaningful to families and important to patients.
Problem with being number 4 is all the good stuff gets taken. So I do think newborn screening will take off if we can figure out how to reimburse it. I'm going to say the controversial thing, which is I think AI is here to stay, and we should just hop on the train rather than be nervous about it. And I think AI is going to fundamentally transform how we do everything for healthcare, including diagnose as well as treat and monitor outcomes. And it's going to completely change how we take care of patients with rare diseases. And I'm actually personally, I have been an adopter of technology my entire professional life. So I am super psyched about how to utilize AI for healthcare.
I agree in terms of first reducing disease burden. Screening is going to be important and should be made more accessible and universal. Cost of sequencing has dropped enormously from a $16 billion genome to what now you can do it for a few $100s. So I think there's a lot of opportunity there. And the other part in terms of the drug in the next 40 years, none of us would have predicted COVID and the way the vaccines evolved so rapidly. I think with the CRISPR and the gene editing technology combined with the fact that gene therapies are becoming common, I'm very certain that we're going to find solutions for many of these orphan diseases. And the disruption in terms of the cost may not happen in the US, but a place like India where cost of innovation still remains quite low and there's a boatload of talent, a place to look.
Dr. Gulati?
I think even in India, is this in advocated that in the next 10 years, you'll be having personalized genome cards, So I think what you think to be screening the population, they will always be screened. So maybe we may be able to prevent certain genetic diseases which coming in families. And we may have more biomarkers and all with research and all to understand and do a primary prevention one. And obviously you have to pick them up early in the pre-symptomatic state when is possible. And as very rightly said, that genome editing and all is going to come up, and all these technologies of ASOs and all that which are there for the DMDs and all, many more things, and autism, which is a big enigma, and in that epigenetics is playing a very major role, and epigenetics is something way forward which may help us to prevent things in the future. I think we're working on genetics as well as epigenetics, because there I feel in many of the situations will be the modifiable things. So when you're modifying the gene expression is being affected, those are modifiable conditions. So even look at the epigenetics and also many conditions. Thank you.
Thank you so much. Please help me thank all the speakers. Fantastic. So next up is closing remarks, but before that, we'll take the customary photo with all the speakers, with the photographer being Nara.